Hi everyone. I'm going to be talking about Australia's universal healthcare system, Medicare, and how it can be approved. I just found this story from over a year ago about someone who called 000, Australia's 911, because some man got hit by a car, so they called the ambulance. And it turns out that she was actually billed for the ambulance because Medicare doesn't cover ambulance. So, Medicare doesn't pay for ambulances. So I'm going to read the article now. Good Samaritan chased by debt collectors after calling ambulance for a man hit by a car. July 19, 2018. Good Samaritan called an ambulance after a man was hit by a car is angry that her private details were forwarded to a debt collection agency seeking payment for the emergency call-out. Jenna, last name withheld, was riding her bike to work in Melbourne in March when she saw the man get hit. No one stopped to help, typical Melbourne, and no one was trained in first aid, so she went back and called 000 from her phone. The man who was hit, named Will, was in shock and pain, was too frightened to go to hospital. I guess the first thing I noticed was that this person looked like he's been homeless for a significant amount of time, but he was very polite and he looked very unwell, she said. I was pretty worried about his state of health and well-being. Will refused to go to hospital. I guess he knew a bit more about the way the system works than I do. A few months later, she was contacted at home and on her phone mobile by ARL, or Australian Receivables Limited, a company which offers a range of debt collection services. That company, a bunch of cunts. I heard this really strange message about calling a debt collection agency, Australian Receivables Limited. I thought that's really odd, she said. About an hour later, my phone rang and it was ARL, and they wanted to talk to me about an invoice that was due to Ambulance Victoria. Jenna said on the second call she threatened the company with legal action. At that point, I got angry. I said, "This is completely inappropriate. I'm really distressed you've called me on my home number. Now you're calling me on my mobile." Jenna said it was unethical and outrageous to chase a homeless person for medical debts, and it was a breach of privacy for Ambulance Victoria to pass her details to ARL. I feel homeless people shouldn't be charged for ambulance call-outs, and I don't think Good Samaritans or passers-by should be followed up and their private details should be shared. Well, in America, a lot of people think they should be billed, but that's another story. Speaking on ABC Radio Melbourne, Mick Stevenson, the Executive Director of Emergency Operations from Ambulance Victoria, apologised. Jenna's got every right to be frustrated and disappointed because it's wrong, he said. They called to identify if Jenna is responsible for the bill. She's not responsible for the bill, so that should have been the end of the matter. What happened after that wasn't procedure. Victorian Health Minister Jill Hennessy said there had clearly been mistakes in Jenna's case, but the public should have confidence in the system. We want our community to feel confident about calling an ambulance, whether they're at home or whether they're a good Samaritan or bystander, she said. Typical yammering from politicians in this state. The circumstances about the cases we've heard today are concerning, and I know Ambulance Victoria are taking seriously. Jenna had been reluctant. No, it's not relevant. This in a further statement, Ambulance Victoria's Executive Director of Corporate Services, Rob Barr, said an invoice was sent to the patient who did not respond or contact them, so the bill was referred to the Debt Recovery Agency. We provided the agency with a phone number, in this case used to call 000, as this can assist in making contact with the patient, he said. A call was made by the agency to Jenna, who had no link to the patient. No further contact should have been made. Let's see. This article just goes on and on. It should get to the point. Oh, yeah. After Jenna's story was... hang on. There's too much noise around here. That's better. After Jenny's story was aired, ABC Radio Melbourne received dozens of calls from members of the public with similar complaints about being chased by debt collectors for Ambulance Victoria. So there you go. Even in Australia, country that has universal health care, Medicare doesn't even pay for the ambulance. It's ridiculous. Like, if you're a retiree or on a very low income or something like that, you don't have to pay. It's covered. But like the fact that in my state it costs more than $1,000 for ambulance call outs. That's how much you have to pay unless you have the free coverage because of concession, or you have private health insurance or ambulance cover. It's just a total joke. I mean, the ambulance coming to wherever you are, going to wherever you are, that's like one of the key aspects of the healthcare, to get you to the hospital, uh, you know, and then you have to pay for that. Medicare doesn't cover it. That's ridiculous. This is the type of bull crap that should be, you'd think is, stuff that comes out of America, but it happens here as well. And I was shocked by this. It's an absolute joke. And I even read that 8% of people that go to hospital in emergencies, 8% of people who go to hospital, they take public transport because they want to save money. Can you believe it? It's just absolutely unbelievable. And also, I found out recently Medicare doesn't, in most cases, it doesn't cover dental either. Dental is pretty important and Medicare doesn't cover it. So, you have a healthcare system, in a country where, that there's a Medicare levy where everyone who has a taxable income, they have to pay 2% extra. So you pay income tax already, then an extra 2% you pay an extra 2% for Medicare, a tax, 2% extra. And even if you don't want Medicare, like you have your own private insurance or whatever, you still have to pay it. So if you're paying for private insurance, you still have to pay the Medicare tax. It's a total joke. Like, it's a scam. If Medicare is not going to cover ambulance or dental, ambulance is way more important. Well, dental is important as well, but ambulance, that's like a key component of healthcare. If Medicare is not even going to cover that, well, why is this 2% tax? Like, you're already paying income tax. You've got this extra 2% tax. It's just total joke. And yeah, I'm absolutely shocked by this. It's ridiculous. I don't know what else to say. It's ridiculous. Not a lot of people don't even know about. A lot of Aussies don't even know that the ambulance isn't covered by Medicare. Talking millions of people. It's crazy. Forget the statistics, but I read about. I think they did a survey on it, and it was like, I don't know how, but it was in the millions of Aussies that didn't even know that Medicare doesn't cover ambulances. So, yeah, I just can't believe it. Medicare needs to start implementing ambulance cover and dental to Medicare. They just need to do it, especially if everyone's paying 2% tax. If they don't implement it, they should get rid of the tax. Simple as that. But, this is just another case of the government, getting as much money as they can off the Australian people and then not providing adequate services. It's just always like that. It's the same cycle over and over. And I don't understand why the Australian people just take it up the arse constantly. They just love their enslavement. I don't have a problem with government services and, taxation to fund it. But if the government is not delivering on those services, then they shouldn't be taking your money. It's simple as that. Like, there should be tax rebates. They should make tax cuts if they fail to deliver the services. I mean, this is not a charity for the government, you know. Like, the reason they get tax money is so they provide these services. It's simple as that. So yeah, the government's not only aren't they not doing their job, but they're taking people's money as well, and you know. So yeah, I'm just fed up of it. Be sure to like, comment, subscribe, share this video, make it viral. Check out my other videos. I've posted a lot of interesting stuff. There'll be more videos coming soon.